This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. Those chromosomal abnormalities are not you. They are everybody's problem. And there are very few women, couples, where the problem is actually in the parents. It's mostly in relation to nature's mistakes that are made in the egg at the time of just before fertilization occurs. So the 1 in 6 that I've talked about is in fact the roll of the dice. That's what 1 in 6 is. And if you get pregnant and you are rolling a dice, there is a chance that you'll get a 6 first up, and that will result in a miscarriage. The odds once you've had a miscarriage actually don't change. Just because you've had a miscarriage doesn't mean that next time you'll have another miscarriage. By no means. For the next pregnancy, your risk of a miscarriage is the same dice. It's still 1 in 6, because these events of chromosomal abnormality are random. It just happens. So 1 in 6 means that after in your second pregnancy, you're still at a 1 in 6 risk, but that's 5 out of 6 times you're going to be carrying a baby at the end of 9 months. On your third pregnancy, if you happen to have the 2 miscarriages before, interestingly, statistics don't change again. It's still a 1 in 36. There's nothing, it's random chance. It's the roll of the dice. You roll the dice once, you got a 6. You roll the dice twice, you got a 6. You roll the dice 3 times, it's still the same dice, and that 1 in 6 is still there. So even after 3 miscarriages, the odds are still in your favour. After 3, it begins to change and be more likely that the next one will be a problem. But it's a pretty marginal change. But I'll talk about that in terms of recurrent miscarriage at a later date. Let's go back to your first miscarriage. Okay, so most of the time with a miscarriage, what happens is that a pregnancy test occurs. You're all very happy because it's the pregnancy that you really wanted. It's what you were trying for. And you feel pregnant. You have the symptoms of pregnancy because the pregnancy hormones are there. They're things that make you feel nauseous. They make you feel tired. They make you have sore breasts. And those hormones will continue on even if you're about to have a miscarriage. It's only when you've had the miscarriage that those symptoms and those hormone levels fall away again. So one thing that I certainly advise patients is that, if the symptoms change substantially, come back and see me. If the nausea gets better and you're only 6 or 8 weeks pregnant, or your breast tenderness starts to get easier, I'd be a little concerned that maybe this is not going to be a good pregnancy. It's not 100% by any means, but it's certainly a sign that perhaps things are not going to be good. So what I do in that situation is to do a blood test to check your hormone levels. But more importantly, at any time after 6 weeks of pregnancy, an ultrasound, a transvaginal ultrasound, and that will give us an idea whether there's an ongoing pregnancy or not. If we see a heartbeat, we're all a great sigh of relief. If we don't see a heartbeat at 6 weeks, it's not the end, because we do see pregnancies that even at 6 weeks don't have a heartbeat. By 7 weeks, however, all pregnancies should have a heartbeat on transvaginal scan done by a competent scanner and with appropriate machinery. If, however, we don't see the heartbeat, that's the bad news, obviously. And for many women and many couples, it's not just the women, that pregnancy, which was so wanted, so planned for, losing that is a disaster. It's a failure. It is feeling like the world is finished. It's what you wanted, and unfortunately, nature's not a nice person. And as I said earlier, 1 in 6 will end up in a situation of not having an ongoing pregnancy. At that point, what I do is go through my earlier conversation, and that is that even with this pregnancy loss, the next chances of the next pregnancy being good is over 85%. So don't lose heart. That's my first message. Technically, what will happen with that once the baby has stopped growing is nature may take its course. In other words, it will realise that their pregnancy is not successful, hormone levels drop, and the uterus responds by contracting and pushing out any products that are sent to tissue, the embryo, and you have what's called a spontaneous miscarriage.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.